Okay, so there's this one drug that for the last few years has been all over the news, right? But what if I told you that behind all those headlines, there's a wild 400-year-old story that starts deep in the mountains of Peru? Today, we're going to pull back the curtain on the surprising and truly unsung story of hydroxychloroquine.
So while you've probably seen it debated on TV, for the doctors who actually use it every day, rheumatologists, this isn't some hot new controversy. Not at all. For them, it's a cornerstone. For more than 60 years, it's been a trusted, foundational tool they rely on. So the real question is, how did it earn that reputation?
It's a pretty incredible question when you think about it. The journey this drug took spans centuries, continents, and some amazing scientific detective work. It's a real story of watching, learning, refining, and, honestly, a little bit of luck.
So here's our game plan. First, we're going to move past the headlines. Then, we'll trace its journey all the way from tree bark to the bedside. We'll get into how it actually works, see why it's a lifesaver, talk about the risks, and then wrap up with the key takeaways you really need to know. All right, let's kick things off by just separating the drug from all the drama. For millions of people out there living with chronic autoimmune diseases, this medication isn't just a talking point, it's a lifeline. And you know, that kind of trust from doctors and patients, it didn't just appear overnight. Its story is this incredible 400-year-long journey, and it's just a perfect example of how medicine evolves from ancient wisdom to modern science.
Just get a load of this timeline. It all starts way back in the 1600s. Indigenous peoples in Peru figure out that the bark of the cinchona tree can treat malaria. Amazing, right? Okay, now jump forward 300 years to World War II. Scientists cook up a synthetic version called chloroquine. But here's the kicker, the part that changed everything. It was a total accident. Doctors started noticing that soldiers taking it for malaria, well, their joint pain and rashes were getting better too. That one observation led to the final step in 1955, creating the much safer version we know today, hydroxychloroquine.
So what exactly was that tweak they made back in 1955? And how on earth does a malaria drug calm down an immune system that's gone completely haywire? Let's take a look under the hood.
You know, the solution was actually pretty brilliant in its simplicity. Scientists took the original chloroquine and just made one tiny little change. They bolted on something called a hydroxyl group. It sounds so minor, but it was a total game changer. It made the drug way less toxic, especially to the eyes and stomach, but it kept all that anti-inflammatory power. That's what made it safe enough for people to take every single day, for years.
Now, to really get how it works, you just need to know about this one little part of our cells, the lysosome. The easiest way to think about it is as the cell's recycling center. It breaks stuff down and processes signals. In autoimmune diseases, this is where the trouble starts.
And this is the elegant three-step dance it does. First, the drug makes its way into those lysosomes and just kind of hangs out, building up. Second, because it's building up, it raises the pH, which is just a sciencey way of saying it makes the inside less acidic. And that leads to the crucial final step. This tiny change in environment basically gums up the works, and it stops the lysosome from sending out those frantic attack signals to the immune system. It's subtle, but it's powerful.
This unique way of working means it also behaves pretty uniquely in your body. And you have to see this. The half-life? 40 days. That is how long it takes for just half the drug to leave your system. And because it sticks around for so long, it takes months, 4 to 6 months, to build up to a level where it can actually start working. This is so important for patients to understand. And finally, it's cleared out by your kidneys, which is why doctors always keep an eye on kidney function. And that slow, steady action is exactly what makes it so valuable in the real world. I mean, this isn't just about feeling a little better day to day. For a lot of people, this drug is literally a lifesaver. It's one of the few medications that is actually proven to help them live longer. Its main jobs are tackling autoimmune conditions like lupus and rheumatoid arthritis. But it's also used for Sjogren's syndrome, some skin conditions, and yeah, it still does its original job, treating and preventing malaria.
This nickname that doctors have for it, lupus life insurance, it just says it all, doesn't it? For patients with lupus, this is one of the only drugs proven to prevent disease flares, stop damage to vital organs like their heart and kidneys, and ultimately help them live longer, healthier lives. It's huge. But look, with any powerful medicine, we have to have a clear, honest talk about the risks. So let's talk about safety, because really understanding the side effects is the key to using this drug safely for the long haul. The main risk, and it's the reason for all the monitoring, has to do with the eyes. Over many years of use, there's a very rare chance
the drug can build up in the retina and cause damage. Now, I really want you to hear that word, rare.
And this chart really puts that risk into perspective. Just look at it. For someone on a standard dose, the risk of developing this eye problem in the first 5 years is less than 1%. More than 99% of people have no issue. That's why for the vast majority of patients, doctors consider this a very safe long-term drug.
And to manage that tiny risk, there's a simple and really effective safety plan in place. You get a baseline eye exam when you start. Then, you don't even start annual screenings until after 5 years of taking it. And the best part is, the tests they use today can spot the absolute earliest changes, way before you'd ever notice them yourself. That gives doctors plenty of time to safely stop the medicine if they ever need to.
Okay, let's wrap this up and pull everything together. If you're taking this medication, or you know someone who is, these are the absolute most important things to remember.
First, I want you to burn this number into your brain. 40. 40 days. That's the half-life. And that one number explains everything about how you have to think about this drug. It is a marathon, not a sprint.
And that super long half-life leads directly to what is, without a doubt, the most important takeaway for any patient. Because it takes up to 6 months to really kick in, you are not going to feel better overnight. You have to be patient. You have to be consistent. Sticking with it, even when you don't feel a difference at first, is absolutely critical for it to work. Here is the second big thing to get. This drug isn't a sledgehammer. It's not a true immunosuppressant that just flattens your entire immune system. It's what we call an immunomodulator. It just gently dials down the specific parts that are overreacting without making you vulnerable to every single bug going around. That's a huge advantage.
And finally, safety here is a team sport. That amazing long-term safety record only works if you're part of the team. The eye risk is super low, and the simple, proven way to keep it that way is to just keep your eye appointments. Simple as that.
So, we end right back where we started, from a Peruvian tree bark to a refined, life-saving, modern medicine. What a journey. It's a truly remarkable story of scientific progress, and it kind of leaves you wondering, doesn't it? After 400 years of service, what other secrets might this old drug still hold? Thanks for tuning in.